7 Skin Signs of Liver Disease. Welcome, health detectives. Today we're spotlighting an important but often overlooked aspect of our health, the liver, and how it speaks to us through the skin. It's fascinating how our body sends signals when something's amiss, and your skin is one of the first to wave a red flag. Are you ready to learn about the 7 telltale skin signs that your liver might be calling for help? From subtle changes to more noticeable ones, these signs should not be ignored. Keep watching to become more attuned to your body's silent messages. Just a quick reminder, this video is intended solely for educational purposes. If you have any medical conditions, please consult with your doctor. Now let's dive in and learn about skin signs of liver disease. First up, we have jaundice, the most well-known sign that points straight to liver trouble. It manifests as a distinct yellowing of the skin and the whites of your eyes, caused by an accumulation of a substance called bilirubin in the blood, something your liver is struggling to filter out. Jaundice can signal various liver issues from hepatitis to cirrhosis. If you notice a lemony tint staring back at you in the mirror, it's wise to seek medical advice promptly. Next is itching or pruritus, a less specific yet discomforting sign. Your liver's health downturn can lead to bile salts building up in the skin, causing persistent itchiness. Unlike regular itches from a mosquito bite or dry skin, this one doesn't seem to have an obvious cause or an easy relief. It might be widespread or focused on certain areas like the palms or soles. Moisturizers might soothe temporarily, but if the itch remains, it's time for a liver checkup. Pay attention if you're spotting spider angiomas, which are small, spider-like capillaries visible under the skin's surface. They usually have a central red spot and radiating capillaries. These spiders often appear on the neck, chest, face, or arms and are indicative of hormone imbalances often associated with liver disease. While one or two might be harmless, a sudden onset or multiple angiomas could signal that your liver is unable to filter hormones effectively, leading to an imbalance and thus these red skin spotters. Next on the list is paper money skin. This term describes the thin, frail texture that the skin can adopt when the liver is struggling. Just like a crisp banknote, this skin feels unusually smooth and fragile. It's a stealthy sign where the skin might appear sleek, but this silkiness suggests a lack of essential nutrients and proteins usually regulated by a healthy liver. It's a direct reflection of the internal imbalances caused by liver disease, often accompanied by a paleness due to the reduced production of red blood cells. Before we go to the next sign, we want to remind you to hit that subscribe and like button if you haven't already. Your support helps us continue creating valuable content for you. Palmar Arithma, a fancy term for red palms, is another subtle cue. The excessive flushing normally occurs on the heel of the palm and sometimes extends to the fingers. It happens due to altered hormone levels, possibly linked to liver cirrhosis, where the liver is scarred and its blood flow altered, resulting in such visible vascular changes. It's not painful, but it's a visual hint that your liver may need some attention, especially if it doesn't fade away or correlates with other symptoms. Keep an eye out for yellowing in the skin around your lower eyelids. This isn't to be confused with the yellowing from jaundice. It often takes a creamy daffodil hue and indicates the buildup of cholesterol, possible evidence of liver disease. This symptom can easily go unnoticed unless you're examining closely. It might be tempting to write it off to fatigue, but it's best checked out, especially if it comes alongside other symptoms or lifestyle factors that might put extra strain on your liver. Last but not least, bruises. Are you bruising easier than a ripe peach lately? This could be because your liver isn't producing enough clotting proteins, making you more susceptible to bruises even from small bumps. If your liver struggles, these proteins drop, and suddenly you're sporting a colorful array of marks from seemingly inconsequential knocks. While everyone gets a bruise from time to time, an increase in frequency or severity, especially if your lifestyle or activities haven't changed, should raise a liver-related red flag. Remember, your skin is the window into your body's health, so keep an eye out for these indicators. If you spot any, it's a good idea to consult a doctor. If you found this video interesting, I invite you to subscribe and check some of our other videos on health and wellness.